Providing medical education, have the requisite accreditation to train doctors, PAs, laboratory technicians with the right curriculum in the right environment so that our people can be safe and have the right treatment that are required. Recently, there have been issues of ongoing reduction in maternal mortality, and has also caught the LMDC concern to work closely with the Ministry of Health to ensure that it's also possible. For the past 3 months, the ABLE team led by our Registrar General, Dr. Puya, has gone through 15 counties, and the goal of that assessment was to make sure that every facility, including the county health teams, the nurses that are present, the doctors that are present, and all other stakeholders had the required knowledge on ethics and cost of care service. The reason this is being emphasized is because most of our parents go to the hospital and they have issues, okay? Communication problem, information problem, confidentiality problem. And we think this is very crucial to our entire health system as well. We must, as a very good body, ensure that our counties, health officers, our medical doctors, PA, nurses have the requisite training in customer service and in ethics. And there are many questions that came up during the wonderful engagements, okay? There were scenarios that were laid apart. A patient comes to the hospital, have waited for 3 hours, nobody has met him, nobody has talked to him or her. The patient gets angry and flare out. What do you do as a health practitioner? Do you respond with the same temperament? These are critical issues that we highlighted. A patient comes to Jehovah's Witness, the patient cannot receive blood in a critical situation. The patient tells you that according to my code or according to my religion, I cannot take this. Okay? Is it incumbent on the health worker to make decisions for that patient despite his religious belief? These are all questions that came up, and were addressed appropriately in every forum. A patient came in, many patients have come who are different ethnicity, of different religion, cannot be examined by a male or a doctor, and request that I cannot be examined by this person because my religion forbids that. How do you address the situation when the only person on call is a real doctor? So there are many ethical issues that arise all the time. It is our responsibility as a regulatory body to address the issues, not to address them, but ensure that those who are on the front line have the required and requisite knowledge to provide the best outcome for the patients. Also, there are issues surrounding confidentiality. Patient comes to the hospital, before they out of the hospital, the information is already to the family, it's already on Facebook. These things are not appropriate because they are very tangible and private diagnosis that people have and they want to remain private. So medical information has to be abide by what the HIPAA law. You have to comply. Before you disclose anybody's information to anybody, you need the consent of the person. Several scenarios that came up. Some relatives brought sponsor patient in Liberia, and then they call, oh, I want this patient, this is what the person's name, can you please give me the diagnosis and what they are doing? Under the HIPAA compliant law, you do not disclose information without the patient consent. You must get the information from the patient first. Can I do this? Or can I go ahead and speak to this person on your behalf? And that's what gave you the cause or gave you the go ahead to do that. In the absence of that, you are breaching ethical principles, regardless of the patient's financial status. Even if you pay for the patient has the right to retain the information as private. So these are many more issues that we have to deal with as a regulatory body. Recently, for the past 1 month, May 6th, the office of LMDC has, with collaboration with the Ministry of Health, and also thanks to CSA, we have deployed over 65 interns, okay, around Liberia. And the interns are doctors in training before they get the license. They are very important to the health system because they are the first liner. They meet the patient on the first encounter. So our job as the council is to make sure that the interns are properly monitored. They provide the most sensitive approach because they are always the first person that the patient meets in every hospital. So the interns are guided by principle. We will ensure that we have to retain the oath, and we'll make sure that they have the required knowledge to keep our population safe. The goal of LMDC is patient-centered. We have to ensure at every point that every patient who comes to the hospital are providing the best care. These are Liberian patients, mostly. A few foreigners go, but we have to treat everybody equitably, okay? And we have to ensure that through proper regulation. So the monthly units I was sent, 40 were males, 25 were females, and they are sent to many referral centers around GFK, EAW Hospital, St. Joseph Catholic Hospital, Jackson F. Doe, J.J. Dawson. So a variety of hospitals where they can beef up the already existing health system that are being enforced by the Ministry of Health. Now, the government of Liberia, through the Ministry of Finance, have provided resources to do a nationwide assessment. The nationwide assessment is one of the core functions of LMDC, and that assessment is to ensure that every health facility around Liberia, that includes public and private facilities, remain compliant with all our guidelines. Now, currently, there are more than 1,000 facilities around Liberia, 60% are government facilities and 40% private. And this has been a great improvement because in 2022, there were 837, and now we have a sharp increment in that number. Now, the issue of facilities open is not just what should catch our focus. Are these facilities that are being open, have they met the basic requirements? Because there are issues when people go to the hospital, the sanitation, the communication, okay, the level of expertise that are expected from those facilities. And that's where we LMC come in. We have to ensure that regardless of the difficulty of the challenges, we must make sure that every facility meets the basic minimum. And this assessment will include first verification of license. We have to ensure that everyone at those facilities, nurses, doctors, PDs, dentists, whoever they are licensed first. That's the first requirement, because we trust the knowledge, we trust the knowledge, the wisdom of the bureau boards that provide this license, and so that we know that we'll be well versed. In this matter, I also want to thank Professor Ken. Professor Ken has been one of the persons, he's the current chair on accreditation for licensure, okay, credential and licensure at the LMDC. And Professor Ken has made sure that people coming into this country to practice meet the basic requirement to be licensed. So we want to thank you for his work and his contribution to the LMDC. Currently, we do have a digital licensure platform. So nobody apply by analog anymore. Everything has to go to a digital platform, and that platform has different levels of approval and verification. So right now, to be declared as a licensed practitioner in Liberia, you have to go to a lot of scrutiny. That means that will be verified at every level. And these measures are intended to reduce quack professionals. Because we have known over the past that these quack professionals, what they have done to the system. Some of the complications that come from our relatives. Okay, people perform the wrong procedures. Some people, we don't want that in our health system. We want a health system that is viable and reliable. We want to reduce the amount of referrals from Liberia to India. We want to reduce the referral. We want to maintain our clients in Liberia. And that can only happen if we have the best checked health system. And thanks to the Ministry of Health, they have been very supportive. Okay? They have provided logistics. They have provided equipment. If you go to most of the hospitals now, they are equipment. Now it's our part that after the equipment have been made possible, we should make sure that the staff, the health workers, abide by all the ethical principles to make sure that patients are treated the right way, diagnosed the right way, and given the best care as they come. Recently, in March, there was an issue of rising issue of maternal and newborn mortality, and thanks to the Honorable Minister of Health, Honorable Louise Amapekut, she launched a national 365-day action plan to end this deadly epidemic, which is the end of maternal and newborn death. It's a very challenging project, but yet we have to help the system. And part of the engagement that we have in the community is that the community leaders themselves came and they said that we ourselves will talk to our pregnant women, we'll talk to our baby mamas so that they carry the patient to the hospital sooner, because Some of the problem is not only the hospital, it can be us. We can sit, we treat with country medicine before we go to the hospital. So you see that if you do proper engagement, things changes, things improve. So with the help of the Ministry of Health with LMDC, you can ensure that what the amount of pregnant women that are dying or the amount of babies that are dying from complications can significantly reduce, because we want to instill confidence in the population, in the Liberian people. We want to tell people that we are here to provide the services that you will need, because that's our responsibility, okay? We will do the best we can to make sure that we are strengthened. And part of the efforts was to improve and equip health centers around the country. If you do that, there'll be reduction in referrals. Most of the health centers will manage some of the complicated cases, and for which we are here, most of them have been dealt with already. Okay? So LMGC in this slide will help to provide guidance in the process. We'll make sure that every facility has what? The requisite or qualified doctor, qualified nurse, qualified laboratory technicians, qualified PE. And with this complicated integrated system, we can ensure that the best outcome can be attained. Recently, the Liberia College of Physicians and Surgeons, we have esteemed first vice this year. Over the past, Dr. Kamala, over the past 10 years, they have been able to produce more than 150 specialized Liberian doctors. So I will be very grateful to the training system, and it's a collaboration between the LCPS and the MOH. The MOH is the scholarship provider, and the LCPS they are the trainers. And we have succeeded to beef up the health system. And there are many disciplines that have been trained: internal medicine, pediatrics, surgery, OBGYN, family medicine, ophthalmology, psychiatry. So you can see how much wealth of knowledge, wealth of expertise that we have developed over a short period of time. It's all due to the support of the MOH, the government of Liberia, and the LCPS. I too benefited from the scholarship of Professor Kennedy and Professor Poto. They provided me a scholarship to Senegal, where I trained for my foreign medical education. So I'm very grateful for that. So on behalf of the health system is moving forward, and with our help, we can make a great difference. Very great difference. We can work together. Now there are a few reforms that the Council has undertaken, and that includes the digitalization of our entire workflow. Currently, every application process at the Council has to go through a digital platform. Every financial interaction has to go through a digital software. And this is done to enforce compliance, maintain transparency, and provide data integrity for everyone. And again, I call all partners, the media, Government of Liberia, the Ministry of Health, the LCPS, MPhil, the Ministry of Information, and all other friends and foreign donors to continue to work together, okay, to help this health.